I got my first retainer when I turned 7 years old. Little did I know from that point on I would be given 7 more dental appliances, ranging from a removable retainer to braces to even a headgear. Although my journey into getting the perfect smile is almost done, it will most likely end with me getting double jaw surgery. This surgery, also known as a bimaxillary osteotomy, according to an oral and maxillofacial blog from Nashville, is a corrective jaw surgery. Today, I will be explaining who is getting the surgery done, uh, what is done during surgery, and the risks and benefits of the surgery. So let's begin with who's getting this surgery done. The normal type of patient who is getting this surgery done are people who have severe over and under bites that cannot be treated with braces. In a clinical report, it is stated that this surgery is not just done for aesthetical purposes, but it is also done for functional reasons. Without without the surgery, the ability to eat and speak can become very difficult, and dental health can deteriorate over time. In my experience, eating sushi and steak is extremely difficult because my teeth are not meeting where they should to give me the ability to chew properly. I've also been told that without the surgery, I risk wearing down my teeth over time and just causing more dental problems in my future. I'd now like to talk about how the surgery is done. First, starting off with pre-op. In my experience, I've been told that there will need to be coordination between the patient's orthodontist and the surgeon because it is required for patients to have braces put on beforehand for best results. According to the OMS Nashville blog, the day of the surgery, the patient will be put to sleep. Then, from there, the surgeon will work inside of the patient's mouth and make 2 diagonal cuts on both sides of the bottom jaw. Then, they will cut horizontally across the patient's top jaw. From there, the surgeon is able to position both jaws correctly, and then finally, the surgeon will bolt both of the jaws in place with titanium bolts. The final part of the process is the post-op healing. Now, during this process, there is a possibility of the patient's jaws being wired shut together for a period of 6 weeks to maximize healing and stability in the jaws. Also, the patient will experience facial swelling around the cheeks, eyes, and lips for a period of months, according to a nursing article. Finally, I'd love to talk about the risks and benefits of the procedure. In the words of my possible surgeon, Dr. Kevin Smith, he describes that there is a 7% risk of permanent loss in feeling, especially around the chin and bottom lip area. There is also the risk of the jaw moving back to its old position if this occurs only if the jaw is not completely done growing, which is why a lot of surgeons run multiple tests to make sure that both jaws are done growing. So when they go in and do the surgery, that risk is very low. But it is still possible if they do not catch it early on time. But there are uh, improvements from the surgery. According to a survey, patients who have gotten the surgery done reported a huge improvement in self-confidence and mental health, quality of life, and in oral health. Um, It is also recorded to improve the aesthetics of the face, especially the chin, the cheekbones, and obviously the smile. But other than that, that's pretty much it. Ultimately, double jaw surgery is not for the faint of heart, which is why it is really important to understand who's getting it, why it's being done, um, how it is done, and what are the risks and benefits following it? Although my dental history has been quite a journey, um, I've learned to be proud of my smile and to appreciate that I actually have a choice in whether I want to get this surgery done. And my hope for you is that you're proud of your smile as well.